Hi, I'm Dr. Linda Carney. Welcome to this hour of high blood pressure. Resolve it with less medicines. When we speak of high blood pressure, the word hypertension is often used in medical charting. But hypertension has nothing to do with tension in a personality as much as it does to do with tension in the arteries, the cardiovascular system. What is the pressure that the blood is under at all times? That's the diastolic blood pressure, the lower number. When you think of blood pressure written as 120 over 80, the bottom number, 80, is diastolic. The top number is systolic. The systolic is the pressure that occurs in the arteries when the heart pumps the blood out with a big push. When the artery is relaxed and the heart is not pushing out but rather filling with blood, that's diastole, and we call the blood pressure that is the constant, the lowest, diastolic blood pressure. Many people get discouraged when the doctor tells them that they have pre-hypertension or that their blood pressure is getting too high and it's time to start thinking about medicines. In my experience, many patients decide that they're going to ignore the doctor's advice for several years. People just don't really want to take medicine every day. That's been my experience. And people feel like it's almost a failure, as if they got a bad grade on a report card, if the doctor tells them they have a new diagnosis of high blood pressure and now they need to take medicine. In my experience, many people resist believing that they have high blood pressure. Many people feel that if their blood pressure is 135 over, say, 89, their blood pressure isn't really that bad. It couldn't really be harming anyone. After all, there are no symptoms, right? High blood pressure has been called the silent killer because there are no symptoms until the organs have been damaged to the point of no repair sometimes. Are we doomed to a life of blood pressure medicine? Do we take them for the rest of our lives with no hope in sight of getting off these medicines? Many people feel that that's the case. However, it's actually true that high blood pressure can be reversed by simple lifestyle measures. Simple, you say? Doctor, it's not so simple to change the way I eat, to change my exercising patterns, to change the time that I go to bed. But when you realize that the power can be in your hands, and if you follow certain practical, simple lifestyle guidelines, you too can reverse high blood pressure problems completely with simple lifestyle measures. Many patients ask me, Doctor, if you prescribe this medicine, does this mean that I have to take it for the rest of my life? My answer is no, you're not going to have to take it for the rest of your life. You're only going to have to take it until your blood pressure is normal without it. So what's a normal blood pressure, doctor? They ask me. And I tell them that my goal for all of my patients is that every time they measure their blood pressure, it really should be below a systolic level of 120 and below a diastolic level of 80. Then they know that no matter what pain or stress, sudden car accident, things like that, raise their blood pressure, the majority of the time their blood pressures are low enough so that their arteries aren't being damaged. Many people feel that the damage that high blood pressure does isn't really happening because there are no symptoms. High blood pressure has been called the silent killer. The reason for this is because blood pressure damages the organs without giving any symptoms until very late in the disease process. Let's look at the three organs that are called end organs whose damage can be modified slightly by the use of medication. The three organs whose damage can be modified when you control blood pressure with medication are the eyes, the heart, and the kidney. Lowering blood pressure with medication can prevent the blindness or the visual impairment that can occur from high blood pressure. High blood pressure damages the delicate vessels at the back of the eye. Sometimes the damage is slow and progressive. Sometimes the damage is sudden. We call it ischemia. It's a lack of blood flow. it means that a person can wake up blind one day and never regain the sight in that particular eye. High blood pressure can be a factor in this disease. The heart has to pump against the blood's pressure. And so if the heart has to pump against a high pressure, that heart, which is a muscle, can thicken and get damaged. This can be caused by a pressure that is a little bit too high for approximately 1 year, as opposed to 1 day or 1 hour of blood pressure that's extremely high. Yes, it's true. It's more damaging to have blood pressure a little bit too high for a year than it is to have 1 day of extremely high blood pressure. Many people feel that if the blood pressure is extremely high, something must be done right now to lower the blood pressure. But actually, physicians working in the emergency department do not any longer these days try to lower blood pressure rapidly with drugs anymore, unless certain really bad signs are happening. And even then, it's a very controlled way of lowering the blood pressure. Physicians now know that lowering the blood pressure in the emergency department, unless a heart attack is occurring or a stroke is occurring, and even then, can be damaging to lower it really rapidly. And so we no longer do some of the things that were done even 30 years ago to lower blood pressure rapidly. But what matters more is not what happens in the emergency department, but what happens in your everyday life to keep blood pressure low. There are things that you can do to keep your blood pressure low. The third organ that can be damaged by high blood pressure are the kidneys. Kidney failure can lead to a need for kidney dialysis. And kidney dialysis is a life-changing condition that is very disabling and difficult to live with for many people. Keeping your blood pressure normal is essential so that you never need dialysis. The heart is one of the end organs that can be damaged by high blood pressure. The heart and the blood vessels that supply the heart, veins which feed blood to the heart, and arteries which carry blood away from the heart, can be implicated when we talk about cardiovascular disease and blood pressure. When blood pressure is too high, it's as if in the lining of the artery, the velvety endothelial lining, a little bit of the lining is scraped out like a divot on a golf course. This is what high blood pressure does. As it goes whoosh down the artery, a little damage is done to the endothelial lining. The body tries to repair that damage by humping up some plaque, some atherosclerotic plaque, a little bit of cholesterol and triglycerides, some fat to goo it over and try to make it smooth again, because the roughness that occurs when you have a divot in the endothelial lining causes the platelets in the blood to clot. The platelets are the blood's sticky clotters, and when the platelets clot, bad things happen usually. To clot just enough, if you've received a surgical wound or a traumatic knife wound, to clot just enough under those conditions is important. Most of the time, we don't need our blood to clot as much as we need our blood to flow smoothly. But there is a fourth organ, the brain, which is also an end organ that suffers damage from high blood pressure. And unlike the other three end organs, the eyes, the heart, and the kidney, whose damage can be mitigated somewhat, whose damage can be lessened somewhat by taking blood pressure medicine, the brain is an organ that suffers damage from high blood pressure, no matter if the blood pressure is perfectly controlled with medication or not. The brain is the fourth end organ that high blood pressure can damage. Unlike the other three end organs, the eyes, the heart, and the kidney, the brain gets damaged by high blood pressure even if the blood pressure numbers are kept perfect with medicines. It's true, there are holes that form in the brain when blood pressure is controlled by medication, but not by removing the factors that made the blood pressure high in the first place. Even if we have perfect blood pressure numbers and they've been made perfect by medication, the damage to the brain continues. This damage shows up as little holes in the brain and can result in memory loss or dementia, and has been implicated in stroke and Alzheimer's dementia. The endothelium is the velvety lining of every artery, and the endothelium plays a key role in regulating blood pressure. But many people think that salt is the primary factor in regulating blood pressure. However, if we understand that the endothelium can cause the artery to dilate or shrink down narrow, we understand that there's a much more powerful factor within our control that we can use completely apart from salt. The lining of every human artery consists of endothelial cells that make a gas called nitric oxide. Nitric oxide is a gas with a very short half-life. It's produced and then it's gone. But the endothelial cell produces nitric oxide to accomplish a very important function, and this is to dilate the artery to its maximum youthful openness. When arteries are dilated wide open and blood flow is good, every organ is nourished to the point of good repair and less inflammation and better blood pressure. But when the endothelial cell is damaged, then the nitric oxide cannot be produced, and the artery shrinks down. The artery becomes narrow in response to the lack of nitric oxide. What causes the endothelial cell to get damaged so that no more nitric oxide can be produced in sufficient quantity to keep the artery open? Let's look at the various factors. These factors were outlined in a wonderful scientific study by the work of Dr. Robert Vogel, PhD. Dr. Robert Vogel gave us the various factors that cause the endothelial cell not to make nitric oxide and causes the shrinking, the narrowing of the artery diameter. When a pipe is more narrow, but the same volume of liquid is flowing through it, the pressure in that pipe has to rise. Thus, a narrowed artery creates higher blood pressure. So, what narrows those arteries? Factor number 1, caffeine. Caffeine is a bad habit that everyone loves to hear good news about. The use of caffeine can narrow down arteries within 20 minutes and keep them narrow for 4 hours. I invite you to go to YouTube and type something into the search field. Type in CNN, brain MRI, caffeine, and there you'll find a video clip of the CNN reporter who was placed in the MRI scanner to take a picture of the blood flow to her frontal lobes. After the image was collected, she was given a cup of coffee, and 20 minutes later, when she had finished her cup of coffee, they put her back into the MRI scanner, and another image was taken. Blood flow to her frontal lobes had been compromised 40% in those 20 minutes. Caffeine is found in coffee, tea, soda, and chocolate. It's even found in small amounts in decaf coffee and decaf tea. But the words caffeine-free means that the product never had caffeine to begin with. Sometimes caffeine-free teas are called herbal teas. The amount of caffeine in chocolate is small, but it's real. There's also a chemical similar to caffeine called theobromine that's also prominent in cacao, from which we make chocolate. But carob, which comes from a legume or a bean tree, does not actually have any caffeine in it. And carob is a sweet substitute that many people prefer to use instead of chocolate. Alcohol is the second factor that Dr. Robert Vogel found narrows the artery and raises blood pressure. We find that this is especially true not when the alcohol is in the system, but after it's been metabolized away. What else narrows arteries by hurting the endothelial cell? Factor number 3 is fat. The fat in our diet, the fat that we eat, whether that fat is animal fat or plant-based fat. Isn't it amazing to think that olive oil can narrow the artery within 20 minutes and restrict blood flow 31% and keep it restricted for 4 hours? The fat that we eat doesn't always have to be removed from its fiber like oils are. Removing a fat from its fiber makes that oil particularly dangerous to the endothelial cell. Within 20 minutes, blood flow is compromised. When blood flow is restricted to the knee, the meniscus can break down or fail to repair properly. When blood flow is restricted to the discs that separate the bones in the spine, we can have slipped discs, herniated discs. We can have poor repair of the tissues that hold the discs in place. Back pain is actually a circulation issue in many instances. The fat that we eat, when it represents more than 20% of calories, can narrow our arteries and raise our blood pressure, independent of the action of salt. Factor number 5 is animal protein. Even if that animal protein, which is found in meat, dairy, and eggs, the products of animals, the flesh of animals, even if animal protein is fat-free, such as egg white, it can still hurt the endothelial cell, shrink the diameter of the artery, narrow it down, and raise your blood pressure. The 5th factor is cholesterol, a waxy yellow substance found only in animal products. Meat, dairy, and eggs are the source of cholesterol. Plants don't really make cholesterol to speak of. I wish I can show you an electron microscope photograph of a cholesterol crystal. It looks like a really narrow, razor blade thin iceberg. As the blood flows by that little iceberg crystal of cholesterol sticking to the endothelium, that razor blade thin crystal of cholesterol slices through the platelets, activating them to microclots. Microclots go downstream and do damage to organs, aging them prematurely. The 6th factor that Dr. Robert Vogel discovered hurts the endothelial cell and shrinks artery diameter are the refined sugars and concentrated sweeteners. Some of these are even completely plant-based, such as maple syrup and agave. Then there's honey, white sugar, brown sugar, corn syrup. All of these can hurt the endothelial cell. This can raise blood pressure, although these products are not as damaging to the endothelial cell as the fats and animal proteins are. The 7th factor to damage the endothelial cell and cause artery narrowing and the rise of blood pressure is tobacco use in any form. Smoking raises blood pressure. That's a well-known medical fact. High blood pressure is just as much a risk factor for heart attack as smoking is. High blood pressure is a risk factor in stroke. So let's summarize. When the endothelial cell is damaged, the artery is squeezed down because no nitric oxide is produced, and this narrows the artery. Thus, that reduced blood flow hinders your healing. It's going to promote inflammation. One of the signs of inflammation is pain. The narrowed artery promotes disease. Lack of nitric oxide narrows the artery and raises blood pressure. You see that high-fat foods, even if they're completely vegan, completely plant-based, can raise blood pressure apart from salt. When blood flow is reduced by the fat in the food, aging accelerates. Here's the good news though. You can nourish your endothelial cells by eating leafy green vegetables. Leafy green vegetables make the endothelial cell so happy that plenty of nitric oxide is produced, and that dilates the artery to its maximum youthful openness. That open wide diameter brings blood flow to heal your tissues, to decrease inflammation, and to repair your tissues. So let's summarize again. Faster healing, stronger muscles, clearer thinking, brighter skin. All of these things are promoted by healthy blood flow. Lower blood pressure, less cancer, more weight loss. These are the things that we can enjoy when we nourish our endothelial cell. Does this mean that leafy green vegetables are the only things you should ever eat? No, hardly. What kind of a diet should we eat to lower blood pressure with less medicine? A diet without meat, dairy, eggs, and oil has been scientifically proven to lower blood pressure without medicine when other factors are also controlled, such as exercise, sleep, making sure that sleep apnea is not a factor. A low-fat, plant-based diet of whole, unprocessed foods can put the control back in your hands, empowering you to lower your blood pressure and possibly be able to no longer need medication. At what level of blood pressure does the endothelial cell get damaged? Dr. Joel Fuhrman, who wrote the book Disease Proof Your Child and Eat to Live, has told us that the scientific studies show that damage to the endothelium occurs when blood pressure hits a systolic of 115 points and a diastolic of greater than 75 points. That doesn't seem very high to most people. That's why I try to get my patients to shoot for the target of having every blood pressure reading below 120 over 80. What other factors can help us to lower blood pressure naturally? Eating whole grains has been shown scientifically to lower blood pressure. What are whole grains? If you're eating wheat, it needs to say whole wheat. Or if you're eating other grains besides wheat, because many people have chosen to set wheat to the side and no longer eat that, it needs to say brown rice if it's rice, or cracked, or flourless, or sprouted. These are all words that can be used to describe a whole intact grain. The less refined the grain, the better it's going to lower blood pressure for you. Legumes are a word that refer to a class of food that includes beans, lentils, split peas, and legumes are great for lowering blood pressure, especially if you eat them at breakfast. But even if you're not eating your legumes at breakfast, eating beans at least twice a day can really help lower blood pressure. Exercise is a key component of lowering blood pressure, and you don't need to go out and exercise so much to the point of injury to lower your blood pressure. Walking briskly has been proven to be a wonderful blood pressure lowering strategy. Walking briskly is a really great idea because it's not so stressful on your joints as jogging or running is. Taking a daily walk is an important part of a blood pressure lowering program. Getting to bed before 10 p.m. is very important to keeping blood pressure normal. This is because when we get to bed before 10 p.m., our body has different metabolic enzymes, hormones, factors that are promoted, which are lost if we stay up past 10 p.m. It's really true that 2 hours of sleep before midnight are worth 4 hours of sleep after midnight. But what about sleep quality? If sleep is interrupted, blood pressure can trend higher the next day. If you have many interruptions in your sleep, either from a pet sleeping with you, a child sleeping or interrupting, a snoring partner, we can see higher blood pressures as a result of many of these interruptions. What about airflow during sleep? Sleep apnea is a closure of the airway. It can be caused by the upper airway, such as the nose, or by the tongue falling back and the tissue sagging. Sleep apnea is more common in overweight people and people over the age of 40 because as the tissues sag and wrinkle on the outside, they start to sag and wrinkle on the inside, and the airway can close as the front wall of the throat touches the back wall of the throat. Sleep apnea is a well-known risk factor for hypertension or high blood pressure. Sometimes we inherit from our genetics a throat that is just very petite, and you don't have to be overweight to have sleep apnea. I would estimate that 80% of the people who have sleep apnea do not know it in its early stages. It's very hard sometimes to realize that you have a problem with sleep apnea. Perhaps you don't have actual closure of your airway, complete closure. Perhaps the problem is a narrowed airway, and that lack of airflow can raise blood pressure for the next 24 hours. There are some people who have broken their nose or who have obstructions in their nose or a deviated septum, and when these are corrected surgically, blood flow can be enhanced by better airflow in the airways. There are some people who have blockages in their nose because of previous nasal trauma. Perhaps they have a deviated septum, or perhaps they have allergies and their turbinates are swollen. Nasal airflow doesn't have to actually cut off the airflow completely, in a word defined as apnea. Sometimes the airflow is simply restricted because of a narrowed nasal passage. When this happens, blood pressure is at risk for rising, and surgeons can correct blocked upper airways and help people to achieve blood pressure that is more normal because of better airflow during sleep. If you suspect that you have sleep apnea, I urge you to get tested by your physician, and I also urge you to not sleep on your back, because in that position the tongue can more easily fall back and block the airway. People with sleep apnea often instinctively learn to sleep on their side because they just don't feel normal if they're sleeping on their back. But not everyone realizes this, recognizes this, and many times people who are taught to sleep on their side improve their airflow, and that can be a factor in lowering your blood pressure a few points. Many people choose to buy home blood pressure monitors and log their blood pressure. This is very helpful to the person and their physician, because when you know what your blood pressure numbers are, you've got a lot of knowledge about how much risk you have and how therapeutic you need your lifestyle to be. I advise my patients not to measure their blood pressure more than once a day, because sometimes you can get a little compulsive about it and it can make you anxious. And if your blood pressure turns out to be high on one reading and you measure it again and again and again over several hours, you get more and more anxious and the blood pressure goes even higher. Pain can raise blood pressure, so can anxiety, and lack of sleep and certain foods and beverages. To summarize the factors that hurt the endothelial cell and raise blood pressure, even apart from salt, we cover the following 7 points. The 7 factors that hurt the endothelial cell are caffeine, alcohol, the fat that we eat, whether it's animal fat or plant-based fat, animal protein, even if it's fat-free like egg white, cholesterol, refined sugars and sweeteners, honey, agave, maple syrup, brown sugar, and of course white sugar and corn syrup. And number 7 is tobacco, which we all pretty much recognize isn't healthy for us. How do we define health? Many people feel that if they have no symptoms, they're healthy. But health is more than the absence of symptoms. Many people feel that if they have no symptoms and they have normal biomarkers, everything's fine and they're as healthy as they need to be. What's a biomarker? Biomarkers refer to numbers that physicians can measure about you, such as blood pressure, weight, or the results on a blood test. You may have no symptoms at all and perfect biomarkers, normal blood pressure and normal results on your blood tests. And yet, disease may be just around the corner. What else is missing in our definition of how health is defined? Body weight is important when we are thinking about the overall health of a person. Although a person may be very active with no symptoms and normal biomarkers, if they're carrying excess weight, this is a risk factor and could mean that their health is not as good as they think it is. But even if a person has no symptoms, normal body weight, normal biomarkers, meaning blood pressure and test results, those people could be even healthier with lower risks if they keep in mind the 8 natural laws of health. The 8 natural laws of health include fresh air, exercise, water, rest, abstinence from harmful substances, a low-fat plant-based diet free of meat, dairy, eggs, and oil, daily sunshine, and finally, trust. How much fresh air do we need? We need 15 minutes of fresh air at least every day. Daily exercise is an important part of maintaining good health, preventing Alzheimer's, preventing stroke and heart attack, lowering cholesterol. Daily exercise has so many benefits. Water is an important component of lowering blood pressure. Did you know that you can keep your blood just as thin as an 81 milligram tablet of aspirin will keep it by drinking 64 ounces of water daily by 5 p.m. if you're a normal-sized adult? Rest is important. Getting to bed by 10 p.m. is very important in lowering blood pressure. Getting adequate rest with adequate airflow during that time of sleep is also a key factor in keeping your blood pressure under control. Abstaining from harmful substances means to avoid things like caffeine, alcohol, other substances that can swell the airways, such as fermented products like vinegar. All of these things may play a role in making sure that you don't need to take medicine to keep your blood pressure normal. Eating a low-fat plant-based diet has been shown to lower blood pressure so dramatically that when we take someone to a resort setting and we provide the food, we have to be very careful for people who are on blood pressure medicine, because blood pressures can normalize so rapidly that within a few days, if we're not taking them off their blood pressure medication, their blood pressure goes too low and they feel too weak to stand up. How do we know this? It has been my privilege to be hired as the medical director previously for the first 7 immersions that were held by the Engine 2 company. My job as medical director of the Engine 2 immersion for the employees of Whole Foods Markets included measuring blood pressures on a regular basis as we put people in a resort camp and fed them delicious buffet meals 3 times a day, plus snacks if they wanted them, and helped them to understand that a diet without meat, dairy, eggs, and oil, a diet of unrefined whole plant foods, could lower their blood pressure and reverse many of their diseases. Twice a year, in the spring and the fall, Whole Foods Market flies in some of their employees from around the world to a beautiful resort just north of Austin, Texas. At the Engine 2 immersion, the exciting thing is that people are fed a diet of unrefined plant foods that are delicious. They love the food. They get to go back for seconds and thirds. They can eat all that they want. At the Engine 2 immersion, where people are eating no meat, dairy, eggs, or oil, I've seen cholesterol come down 100 points in 5 days. I've seen blood pressures come down fast, and by Wednesday of the week, I have to take people off of medication sometimes to keep their blood pressure from going too low. There are 3 ways that circulation can be hurt. Circulation can be hurt by the process of atherosclerosis. This is the progressive slow narrowing of the artery. It takes years. The higher your cholesterol levels are, the higher your blood pressure levels are, the faster it occurs. And yet, this progressive narrowing only accounts for 12.5% of all heart attacks. The second way that circulation can be damaged is a rapid narrowing of the artery within 20 minutes by certain foods and beverages, such as olive oil, that shrinks artery diameter 31% within 20 minutes. This is the second way that arteries can be damaged and blood pressures can rise. The third way that arteries can be damaged is a rapid way, and it takes only 3 minutes for a soft atherosclerotic plaque to rupture. This can make a clot start to form, such that an artery, which was only 20% blocked to begin with, but then when its plaque ruptured, it developed a clot that made it 100% blocked within 3 minutes. This is the cause of 87.5% of all heart attacks. The third way that an artery can be diseased is rapid blockage, going from 20% to 100% blocked within 3 minutes. How does this happen? A soft atherosclerotic plaque ruptures as the blood pressure goes over, whoosh, 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 goes over that roof of that atherosclerotic plaque. A little crack in the plaque wall, or a rupture, exposes the blood's sticky clutters on the outside of the plaque to the goo, the triglycerides and cholesterol, on the inside of the plaque. This atherosclerotic plaque then creates a blood clot in the artery that blocks the artery completely within 3 minutes. This artery, completely blocked, can then cause a heart attack. This is the cause of 87.5% of all heart attacks. A diet without meat, dairy, eggs, and oil that is comprised of whole plant foods in unprocessed form is how we describe the Starch-Smart program. The Starch-Smart program can be discovered at www.starchsmart.com, and there you can share recipes, read blogs, interact on forums, and have a social networking site where people can share ideas of how to adopt a whole foods plant-based diet in their busy schedule, on their limited budget. It's important to prepare your food ahead of time. A good breakfast of these 4 categories of foods can be very helpful. The 4 categories of foods for breakfast are beans, greens, squash, and yams. When you eat those 4 categories of food, that helps you to have the lowest blood pressure of that day. Why? These categories of foods help nourish your endothelial cells so that you've got the maximum amount of nitric oxide dilating your arteries. Don't let half the day go by before you're eating your leafy greens. If you've got blood vessels that you want dilated, feed them at your very first meal with leafy green vegetables, and you'll have the lowest blood pressure that you could possibly have for the whole day. Preparing breakfast ahead the night before is very important because we're all busy in the morning. Put that breakfast on a plate, put a cover over it, put it in the fridge so that if you've got to dash out the door in the morning, you're all ready to go. Microwave it if that's the fastest way, because eating a whole foods plant-based diet, even if it's microwaved, is much more important than avoiding a microwave and eating convenience foods instead. Carry food with you in leak-proof containers wherever you go, because if you're caught short with no food to eat, you're much more likely to cave in to cravings and temptations. Many people wonder how in the world they'll get along without oil. How will they bake? How will they saute onions? How will they dress their salads? Baking without oil can use substitutes like mashed banana, pureed pumpkin out of a can, or applesauce. Salad dressings can be made without fat at all by using a splash of lemon juice or lime juice and seasonings such as onion, garlic, dill. However, if you want to add some fat, try a tablespoon of walnuts, perhaps a tablespoon of flax in a blender in a small amount of water, and puree them so that they're creamy in the blender. Add in some lemon and lime juice. I like to add in onion powder, garlic powder, dill, and sage. Even if you use some salt, your blood pressure can still be lower if you're eating a low-fat plant-based diet. Watch out for nuts that are roasted or salted. They're often covered with oil, and even though salt may not be the major factor, it still plays a role in raising blood pressure. Water follows wherever sodium chloride goes in the body, and sodium chloride is another way of saying salt. Although salt is not the major factor in raising blood pressure, it's still an important factor. For best success, eat breakfast like a king, lunch like a prince, and supper like a pauper. Breakfast like a king means a big quantity for breakfast, and supper should be lighter and fairly early. Eating late can raise your blood pressure for the next 24 hours. There are wonderful cookbooks that can give you the recipes that make this easier for you to enjoy these foods. It's not a diet of deprivation. The wonderful cookbooks include Prevent and Reverse Heart Disease by Caldwell Esselstyn Jr., MD, The Engine 2 Diet by Rip Esselstyn, Austin's plant-strong firefighter. John McDougall, MD, has written The Starch Solution, and it's a great cookbook. One of my favorite cookbooks is The Forks Over Knives Plan by Drs. Matt Letterman and his wife Alona Pulde, MD. There are free websites such as Starch-Smart.com, HappyHerbivore.com, ohsheglows.com. These places will give you recipe ideas with pictures and shopping lists. The good news is you don't have to stay on blood pressure medicine for the rest of your life if you can get your blood pressure numbers normal without them. The best way to do that is with lifestyle measures. In fact, it's the only way that can protect your brain, because remember, your brain can be damaged by high blood pressure even if your numbers are made perfect with medication. It's not a diet of deprivation to eat a whole foods plant-based diet without meat, dairy, eggs, and oil. Eating a Starch-Smart system can make you feel full and satisfied. You can learn to love your food, and you can have plenty to eat everywhere you go. Don't despair if you've been diagnosed by your physician with hypertension and told that you need to take medication. It's important to work closely with your physician when you're adopting a low-fat, plant-based diet because blood pressures can fall rapidly, and so you're going to want to have a home blood pressure monitor that you can trust to write down your blood pressures and bring them in and work closely with your physician so that you can wean off your medication safely and scientifically. In this instructional video, I'm not giving you personalized medical advice, so please take it as simple health education. However, it's important that you work closely with your physician so that if your blood pressure is falling rapidly because you're adopting the lifestyle measures that I have taught you about, you can be safe and scientific as you wean off your blood pressure medication, measuring your blood pressure daily, logging your progress, and communicating regularly with your physician. Fiber and water together make bulk. This provides satiety or satisfaction. You can feel full and satisfied, eating all you want, and not feel deprived. A life free from high blood pressure can be yours. Remember, the low-fat, plant-based diet has been shown to be the most effective way to lower blood pressure naturally without medication. Best wishes to you as you take the control of your health in your hands and protect yourself from the ravages of untreated high blood pressure. Until next time, I'm Linda Carney, MD, wishing you the best of success.